sorry. Am I good to go? Okay. Hello, everyone. Thank you for joining us for Cleveland Motep's Let's Talk About Vaccines podcast. I'm happy to be joined today here by Elizabeth Green and Sharon Thomas from Centers for Dialysis Care. Today, we will be talking about COVID-19 and the safety measures that Centers of Dialysis Care have implemented before and after the pandemic. For more info on vaccines and Cleveland Minority Organ and Tissue Transplant Education Program, please visit clevelandmotep.org. Sharon and Elizabeth, would you love to introduce yourselves?
Absolutely. Thank you. I'm Elizabeth Green from the Centers for Dialysis Care. I'm the Director of Education there. Been an employee at Centers for Dialysis Care for 23 years.
And I'm Sharon Thomas. I'm the Vice President of Patient Care Services, a registered nurse. Been with Centers for Dialysis Care for 7 years now.
Cool. Could you guys give us more information about CDC's vision and services and the different locations that you guys have?
So Centers for Dialysis Care is a Northeast Ohio-based dialysis company, and our vision is to be the provider of choice for the most trusted community center for high-quality, patient-centered kidney health care. So a pretty lofty goal, and again, our focus is truly on quality of care and patient experience. We are located throughout Northeast Ohio. We have 16 outpatient clinics. And we cover Cuyahoga County, Lake County, Ashtabula County, Mahoning County. And we have 6 traditional home care programs where we teach our patients to do either hemodialysis or peritoneal dialysis in their own homes. And then we also provide some services to some local acute care providers and in some nursing homes.
Wonderful. So we're here today to talk about COVID-19. Could you talk about the initial feelings at Centers for Dialysis Care around COVID-19, and what were sentiments that were going on in your specific departments or other leadership personnel?
I think initially the kind of feel was we were taking it very seriously from the start, because as we participated in national provider calls, other providers across the country had positive cases far earlier than we did, and with serious illness and serious outcomes. So I believe right from the start we were very proactive.
That's good to hear. Anything you would like to
Yeah,
add?
we just learned a lot. I mean, we engaged with the group of kidney care providers and truly learned, from the West Coast and New York, what was working, what wasn't, so we could adopt those measures that are working.
Okay. What were some of the initial steps you guys began to take after hearing about COVID-19?
Right from the start, leadership began meeting daily, and they also provided daily update calls based on local, state, and national numbers to all the staff, allowing them to ask questions and be really up to date on what the situations were, again, locally as well as nationally. We put together a treatment plan right from the start on how we would, in fact, treat a patient if they were positive for COVID-19, to make sure that both staff and patients were protected.
We did a lot of education with the staff so that they felt comfortable, put processes in place so if patients were symptomatic, they weren't coming back into the clinic and exposing people. So isolating those patients so a nurse can assess them and make a decision, are they safe to treat or do we need to send them to the hospital? Obviously, what we do, personal protective equipment is our norm. We do that all the time, so that wasn't new for us. But we did the same thing, social distancing, our chairs are at least 6 feet apart, masking. So for our staff, masking was the norm, but we put a mandate in place that patients had a mask too.
Okay. That's good. How did CDC adapt to remote work, or were there any flexible work arrangements during the pandemic? I know that can be a challenge, especially doing outpatient dialysis care.
Well, for our clinical staff, for us it was business as usual.
Right.
It was all hands on deck. Let's take care of the patients. But for our employees that are not in the direct care part of the job, they were allowed to work from home. Okay. So working with our IT department to get computers and access is set up at home, and that actually went pretty smoothly.
Yeah, everyone was provided all the resources they needed to set up and be effective working from home.
Wonderful. I want to talk about how CDC supported mental health as far as COVID-19 with employees and both patients, because that's really important. Everyone's isolated, everyone's alone. How did CDC really help people through that?
I think for the patients, we did provide them a lot of education from the start on how to keep themselves safe. They had to come to dialysis, so they did have some of that community still with the other patients. For staff, we did provide the services of a licensed psychologist.
Yeah.
She made videos discussing different aspects of mental health and how to care for ourselves and take care of things. And she was also willing to speak to people if they wanted to.
Okay.
And I think also the meetings, the weekly meetings, it was open to, it was a phone number you call in, it was a phone conference, and allowing people to call in, ask questions, trying to allay fears and anxieties. I think that helped a lot also.
Absolutely.
And then how do you think these measures, how have these measures evolved over time? Is this something that CDC is still putting money towards? Is there mental health services for patients still to this day?
We do.
Okay.
Again, most of our mental health interventions are assessment, referrals if necessary, but truly focusing on education and emotional support. We have a strong crew of social workers who, as a routine part of their role, is to do some mental health evaluations and make referrals as needed.
We talked about infection control measures. They were already the norm. Was there anything that was specifically new once COVID happened?
We did implement some further disinfection and cleaning of surfaces. So high touch areas were being disinfected on a regular intervals, which we hadn't done before. Also, we did screening for symptoms at the door as people entered, so that if you did have symptoms, we could isolate them and decide how to move forward with that. As well as we did not have any visitors coming into the unit, so there was nobody extra coming into the building that wouldn't have to be there for the reason of having treatment.
So on a normal, before COVID, people were allowed to bring visitors.
People could bring someone to sit with them, correct, or have a visitor during their treatment.
And the other thing we did is for our positive patients, especially when our number, originally, we had one at one facility, one at another facility. But as the numbers started growing a bit, we created a cohort facility so that all of our patients that were COVID positive were treated in one facility where there were no other patients. On those days, so there was no exposures. That staff got, again, enhanced education. Liz's staff did a great job going out there and, reviewing all the infection control to keep them safe too. And that way we kept all of our patients safe.
Yeah, that's wonderful. Did CDC implement any unique initiatives to support local, community, or healthcare efforts in response to COVID-19?
What we did do is when we became vaccine providers, when we had vaccine clinics, we were offering vaccine, we did allow both staff and patients to bring in friends, family, whomever, to receive those vaccines when we had them available, as well as sometimes if we had open vials that we needed to use, we would call around and offer them to local establishments or agencies to make sure everyone, and especially our nursing home partners and those types of places, to make sure everyone had access to the vaccine.
And we also did vaccine clinics with MOTEP.
Yeah,
yes, we did.
Hosted
my time,
a couple of
yes,
them.
I heard.
Yep.
How is CDC addressing the potential challenges posed by the simultaneous presence of COVID-19, RSV, and the flu? We know it's really flu season. How are we making sure we're encouraging our patients to still get their flu shots, get updated COVID shots, get their boosters?
Yeah, we talk about that all the time in the clinic. So there's flyers up. We certainly, I don't think anything replaces the communication, one-on-one communication with patients, and encouraging them to get their flu shot. We offer them right in the clinic. So we try to make it as easy as possible so that they can get their flu shots. Again, we still maintain the mask mandates. Patients we still encourage to wear masks, and we hope that will decrease incidence of flu also.
Yeah. Liz, is there anything you wanted to share? Okay. what are some things that we implemented during COVID that are still here today, besides the masks and the vaccine clinic?
Well, the PPE, again, it was before COVID, during COVID, and it remains in place. The other thing that we did implement during COVID was the use of the N95 respirator. Again, we continue to fit test every clinical staff member annually to make sure that they are fitted into a respirator should there ever be a need again to use them.
Wonderful.
And the screening of patients still remains so that, if there's somebody that with suspicious symptoms, that there's special precautions taken to isolate, to separate them from the rest of the other patients to keep everybody safe. And then the staff will wear different enhanced PPE to take care of those patients.
Liz, I wanted to ask you about the education department. What kind of things were you guys doing in the education department to educate patients about COVID-19?
We don't do patient education per se in the education department, but there was a lot of education that went out for patients that we gave them, flyers, displays in the clinics. But yes, a lot of education. We provide education for the staff predominantly in the education department.
Was there any resistance to was there any resistance to COVID-19? Were people kind of skeptical about it? Was everyone all across the board we need to do?
I think so. I mean, the patients are, a part of the community, and just like in the community, there was some resistance. Certainly, there was some resistance, but I think that's expected. But everyone was, I think, very cooperative in making sure their masks were on. They were being screened. They were washing their hands. All of the normal things.
Great. I think that's really all the questions I had today. Thank you for joining us and sharing what Centers for Dialysis Care was doing during COVID-19. Great speaking with you guys.
Thank you.
Thank you very much.